Welcome to Mommy Heal Thyself. We feature guests who provide you with the tools, resources, and strategies you need to say no to a life of pain and suffering from all forms of preventable disease, toxic drugs, and unnecessary surgeries. We hope to inspire you to boldly reclaim your ability to heal and to serve the ones you love.
Hello, everyone. Welcome once again to another episode of Mommy Heal Thyself. Today I have with me Twila Brase, and she is the president and co-founder of Citizens Council for Health Freedom, CCHF, a national patient-centered, privacy-focused, free market, nonprofit policy organization launched in 1998 to protect patient and doctor freedom. She is the author of the 8-time award-winning book, Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records, which is now in its third printing. Twyla's efforts led to a temporary national law requiring parental consent for research using newborn DNA and a national campaign exposing HIPAA as a data sharing rule. She's the founder of an online nationwide directory of direct pay practices known as the Wedge of Health Freedom. She also launched the Patient Toolbox, an easy-to-use tool to help patients understand their options in coercive situations and to maintain control over their treatment decisions. During the COVID crisis, she initiated the CCHF's Face Freedom campaign and Don't Be Bullied billboard campaign to stop mask and vaccination mandates. Her campaign to separate Medicare enrollment from citizen access to their rightful Social Security benefits was supported by more than 44 free market organizations nationwide. This request was successfully included in President Trump's Medicare executive order signed on October 3rd in 2019. Twyla's Health Freedom Minute is heard weekdays by more than 5 million listeners on approximately 870 radio stations in 47 states. She provides testimony at state legislatures, meets with members of Congress and healthcare policymakers, conducts original research, and speaks around the country, and has been featured and quoted by CNN, Forbes, Fox News, Fox Business, Nature, NBC, Politico, Science, The Hill, Epoch Times, and the Wall Street Journal. And in 2021, she authored the CCHF's COVID-19 Quick Reference Guide, which was published online in December 2020 and updated in 2023. The guide downloaded over 140,000 times on the CCHF's website alone, and it includes a quick action summary and instructions on early treatment kit. Now, since 2017, her efforts have stopped the unique patient ID each year, and in 2022, she testified before the Wyoming legislature, and in 2023, her work led to the passage of the nation's strongest genetic privacy law. Now, Twyla, I tell you, you are a busy woman. Oh my goodness gracious. Woo! Thank you so very much for being here with us. And I guess where I want to start our conversation today is, how did you get started? How did you even come to understand the way in which our health freedoms and our privacy is being breached in the first place? Because most of us have no clue of any of this. So how did you come to be aware of this?
Well, I think, being a registered nurse, I have, worked with patients for a long time, but I have always had a real support for freedom across the entire scope. And when the Clintons decided to take over healthcare, I realized that if they took over healthcare, they would take over the country. And that was the beginning of my foray into policy. Mm-hmm. And I really felt like God was telling me to start an organization out of nothing. And so here I am 30 years later, becoming a policy expert in healthcare and in privacy policy. And, certain things just make sense if you can connect the dots. And if you do enough research, the dots start to be connected. And so I've had a long time to come up with realizations that maybe other people haven't seen.
So I want to start a little bit from couple of years ago when you started the initiative to make people more aware of the reality of HIPAA. And if you could explain to us, what is it that people usually think about HIPAA and how is that not exactly in alignment with what's really going on?
Yes. And so probably for about 15, 20 years, actually, we've had a campaign to get people to stop signing the HIPAA form, which today is no longer a form. It is a statement buried oftentimes in the consent form. And it says, I have read or I've understood the notice of privacy practices. And so I'll just say more about that in a minute. But the American people need to understand that HIPAA was sold as a privacy rule that was going to protect their privacy. But in the industry, they know that it is no such thing, that it's actually a permissive data sharing rule that allows millions of entities, well, I should say 2.2 million entities, but a lot of the people within those entities to have access to their data without their consent, unless the hospital or the doctor refuses to share it, or unless they've got a stronger state privacy law, which most states don't have. So people believe HIPAA protects their privacy because that's what they've been told. A lot of the clerks at the hospital or in the clinic, they believe it as well. Although if they really thought about it, they'd understand how much information they could see, how much information others could see, all without the patient's consent. And so this was, Americans were sold a bill of goods here because everybody wanted to get their hands on this very valuable data called patient data. And they didn't want to have to ask the patients for it. And so I wrote the book, Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records, to both talk about the fact that they don't have privacy, but not only that, but the government imposed a mandate that all this data be digitized and made accessible through the internet on information exchange systems, state and national. Therefore, there are so many people, because HIPAA doesn't protect your privacy, there's so many people that can have access to the data through these electronic networks, these cyber networks that go across the country, State Health Information Exchange or the eHealth Exchange, which is a national data system. And there's no consent requirements, again, unless your state has a stronger privacy law.
Wow. So in reality, the HIPAA is a misnomer. It's like actually the reverse of what we think it is. You know, I know whenever, and as you said, we used to sign it, but now it's not something that you sign. It's just like, okay, here's a HIPAA statement. And in our thinking, we are led to believe that this is going to protect us. This is going to ensure that our data doesn't get into other hands and the information stays between me and my healthcare provider. And what you're saying is that in actuality, it allows the government and 2.5 million different entities to have access to our data. That is scary stuff.
Yeah. Yeah. Well, the history of HIPAA is written in my book because I thought nobody understands this. Everybody has been led to believe something completely different than what it is. We do call it the greatest deception foisted on the American public, and they're actually being exploited in the exam room. So when you get those intrusive questionnaires, some people now are getting questionnaires called social determinants of health, which want to know everything about your life. They want to know like what your income is, what your employment is, do you drive a car, how close is the nearest grocery store, all of these sorts of things. And they're using the exam room as a data collection center. So that the exam room is supposed to be a sanctuary, a private, protected space where you can say what you have to say to get the care that you need. And it's really become a place of exploitation. And if you don't fill out those questionnaires, sometimes you get pushback from the staff, and that shouldn't be the case. But we do have something called discharge instructions, CCHF discharge instructions on our homepage to help you in the exam room, both to get the care that you need, but also to figure out how to not sign the questionnaires or fill out the questionnaires and to not sign HIPAA. And so you can just get that on our homepage under helpful handouts, which is right on the homepage, and just click on helpful handouts, and then you can find the discharge instructions in there.
Yeah. And you have so many goodies on your webpage, and we're going to be including that link in the show notes. So I encourage everyone to definitely head on over to CCHF's organization's website. Now, I also want to dabble a little bit into the DNA project, because again, something that mommies are not aware of. And again, they keep telling us about China, and they're worried about TikTok getting our information from China. But mamas, you've got to hear this. Tell us, Twyla.
So in 2003, we discovered that health departments were keeping the DNA of children from birth. So through the newborn screening program, which is really a government genetic testing program. So parents don't understand that either. But it is considered the largest population-wide genetic program in the country. And the word genetic is never talked about typically when they're talking about newborn screening. Now, a lot of people really like newborn screening, even if it's a genetic program, but they don't like the idea that the government is doing it. They don't like the idea the government is keeping their child's DNA and sharing it. And they don't like the fact that the government is using it for their own purposes. And so when we discovered this, we realized that really what these are DNA warehouses started at birth. There's 4 million babies born a year. Or it could be a little bit lower now because the birth rate has gone down, but still it's a lot of babies. And there are several states that keep that DNA forever. Now, if they wanted to take your DNA or mine and store it with the government, it would be a crime against us unless we were criminals, right? But babies aren't criminals. And yet the government has found this way to store their DNA. And in New Jersey, we see how it was used. The police department had somebody that they wanted to find and locate. And so they got permission. I don't know how they got permission. They certainly didn't get it from the parents to go into the baby DNA warehouse essentially and look up the relatives of the person that they thought and see if this would match, right? So there's a lawsuit in New Jersey right now against the government for doing this. But also, this DNA is being kept for research. It's being given away. California gives it away sells it at, they wouldn't say sell, but at about $20 per punch. And so parents, sometimes you don't even realize newborn screening has happened, but this is the prick on the heel at the hospital within 24 to 48 hours. And then they squeeze the blood out onto a card with a special filter paper on it. Now, there used to be only 1 dot. Nowadays, there's about 6 because they're doing more tests on babies. At one time, more genetic tests, but also they're making it available for other things, right? Without the parents' consent. And so we encourage parents to get privately tested, or if your state has a law that allows you to force the department to give you that card back or to destroy it and to destroy the results out of the government's records. We encourage you to do that. And we have a special webpage for this issue. It's called itsmydna.com. And you can find out how long your state has kept your baby's DNA. And then if there are any opt-out forms, now there might be some opt-out forms that we don't yet have and haven't discovered that exist around the country, but several states have them already, and we've got those up. itsmydna.com.
Now, we are ending October when we're recording this. We're ending the month of October, and many people are faced with Medicare enrollment. I would love for you to tell us a little bit more about what people are probably not aware of as it pertains to Medicare, and why it's so important for them to reconsider some of the decisions that they may be making at this time, and what are their options.
So I'm glad you asked that question. I don't know if you know, but we have just released a Medicare how-to guide, and I suspected you might know that. So, and it's very exciting. It's the first ever. It's unique. It's not like anybody else's guide at all. It includes 10 Medicare traps that you want to avoid. And right now, everybody who turns 65 and over, unless they're in a company with 20 or more employees, has to sign up for Medicare if they want their Social Security benefits. They don't have a choice. And so that's the first Medicare trap, is that you don't have a choice with Medicare. Now, a lot of people really like Medicare because there's the costs that they pay are much less. But Medicare is running out of money in a very, very big way, running out of money. And so just one example, 2022, $905 billion was spent by our federal government for Medicare. But that was about $54 billion over what came in revenue.
Wow.
Right. So, so it's like, having $100, but something is going to cost you, $1 million. Right. So, so Medicare is dying and people don't know that, but they're being forced into Medicare. And so the rationing of care is going on in earnest. And one of the places that it is most happening is in the Medicare Advantage program. So Medicare Advantage, there's about 70% of all seniors have chosen Medicare Advantage. I'm sorry, that's wrong. About half of the seniors, more than half of the seniors in Medicare have chosen Medicare Advantage, and about 70% of them have no premium. So this looks like a really great deal, right? No premium whatsoever. And this is because the federal government, through taxpayers, is paying this huge chunk of change to the Medicare Advantage health plans per member per month. No matter how much care you use, they get this block of money, right? But then they have the authority to deny you access to the care it would pay for. They can say it's not medically necessary. They can limit the network of doctors that you have to use. So you might want to get in a month, but you can't get in until 6 months, right? Because it's a limited network. You can't just go and live somewhere else for longer than they say you can live there, because you'll be out of your network to get care. I mean, there's all these different kind of rationing strategies. So one of the biggest things that people need to know is Medicare, original Medicare versus Medicare Advantage. And so we, in the guide, we warn against Medicare Advantage. We talk about the fact that even the federal government has said that they ration care. And in fact, they, for the denials that they give out, 75% of the time, if the patient appeals, or if the doctor appeals to get paid, because the Medicare said, we're not going to pay you. If they appeal, 75% of the time, the Medicare Advantage organization overturns the denial. But as the federal government found out, only 1% ever appeal the denial. Right? They're too sick. They're too injured. They don't speak English well enough. Whatever, they think they need an attorney. It's a very convoluted process. They don't have time. They need the care, right? And so even the federal government says that people in Medicare Advantage are being denied access to medically necessary care that even Medicare approves. So it's just very lucrative for them, right? They just deny, and they see who has the wherewithal and the ability to appeal, and then they'll give them the care.
It's so horrible.
So that's one of the biggest things. But one of the other things is just to know the deadlines. Don't miss the deadlines. Understand the deadlines and the other choices, including the deadline. If you go into original Medicare, you only have 6 months from when you get Medicare Part B to get Medigap to help you with the coinsurance, the deductibles. When original Medicare stops paying for your hospital visit, because it's not insurance like other places. After a certain amount of days, it stops, and only if you have Medigap will you not have to pay for those days all on your own.
It's horrible the way in which the system takes advantage of people in their most vulnerable times, and I think nothing reflects that more so than the 4 years, I guess now going on 5 almost, of the COVID era. I would love for you to tell us a little bit more about what did you see happening during that time, and what were some of the things that CCHF did to help out the citizens?
So the power that the states had to impose lockdowns really started 18 years before COVID began. And we were engaged in that battle. It was called the Emergency Health Powers Act, the Model State Emergency Health Powers Act. And the CDC, it was right after 9/11, like 6 months later, the CDC pounced. They'd been planning for 3 years to try to get states to empower the health officials in every state in a declared emergency. And when 9/11 happened, they issued this Model State Emergency Health Powers Act, and they asked every state to pass it. And a boatload of states did. And so when COVID happened, they had all of these powers to do the lockdowns. They had all of this power within the health officials in the states. Plus they had the CDC saying X, Y, and Z, right? And then other health officials just, said, well, we need to do this. And they just did it, right? So what was really happening there was that all of the, or not all, but a lot of the individual rights and certainly constitutional rights were suspended. They were violated. And then the other thing probably to notice beyond the lockdowns, right, is just all the disinformation. All the disinformation. The fact that they knew from the get-go that this was probably out of China. The fact that we have an email from Fauci, I think it's February 1st, 2020, talking about how masks would not help. He told a former secretary of the Department of Homeland of Health and Human Services that the mask wouldn't work if she went on a plane. He knew it, right? And he just flip-flopped all over the place whenever the narrative was supposed to change, but he knew it in that private email with her, right? That mask wouldn't work. And so imposing masks was such a offense against so many things, your dignity, your right to breathe, your right to breathe free, your right to walk around and not have people look at you as though you were an enemy. So there's that sort of thing. And then when it came to the shot and when it came to ivermectin, so they knew ivermectin. NIH was actually doing studies of ivermectin and cancer. And today we're seeing how ivermectin is curing cancer. This is a most amazing thing that has happened. But the NIH was already doing studies. And so their claim that this was dangerous, they knew it wasn't dangerous. And yet they couldn't afford to have a cure because they had already decided that they needed to impose a shot. They needed to call it what was not a vaccine. They needed to call it a vaccine so they could get past all of the prohibitions on just, requiring people to have it. They knew that they wanted to create a mandate that would set a precedent that whenever the government said, thou shalt be vaccinated, it would then become part of the policy forever. Well, happily, they did not succeed. Because there's a whole bunch of people who said no, or they said no after the second one, which is good, because now we have scientists saying that if you got more than 2, you really shot your immune system down significantly for future bacterial and viral infections. So there was just so much wrong with this, but this was the public health officials, this was government seizing control, using an emergency to seize control to try to set precedents for the future where they would have this kind of power on into the future, and all sorts of governors just bowing to them and enjoying this experiment for how they could seize control over the American public.
Wow. Just so many things to consider. Now, I'm curious, as we start to wrap up, what do you feel is the most important thing that we need to know as we move into 2025?
Well, one of the most important things that we have not discussed is the fact that there's this real ID card
Oh, yeah.
And you're being pushed to do it and to get it. And I'm here to say, do not. And that you do not have to get it, that this is a national ID card, that this is a usurpation of states' rights, that this is unconstitutional. And it's not just a card, it's a system. And it will lead to the social credit system of China, where, and they want to put it on your card. They testified in December that they want your driver's license on your phone.
Mm.
And so they want to have control of your phone. And that's exactly how this happens in China. And so there are 45 states that give you a right to not have a real ID, to have a standard driver's license, and you should stick with the standard driver's license. They want to impose what they call progressive consequences and progressive enforcements. And so what you need to know is get yourself a passport if you're worried about flying. If you're worried that they will be successful in tipping the whole system over to real ID, get a passport and then refuse to get the real ID, because you will be able to fly with the passport, as well as 16 other documents that the TSA has on their website. People can go to our page. We just had a big campaign to get people to oppose this new strategy of theirs to begin progressive enforcement and progressive consequences, including a 3 strikes, you're out. They want to let you come to the airport 3 times, and then the 4th time they'll send you home with your children, your luggage, and your tickets. This is what they want to do starting May 7th. So everyone should sign up on our website to be notified for the next thing to do to oppose this encroachment upon the entire country, this takeover of the entire country with this kind of a system. And certainly can contact us about, what to do. Because if you have a real ID card today, it has a star on it, some sort of star on it. And you can go and get a standard driver's license, just go and replace it. Maybe you lost it, maybe you misplaced it, right? And then just go and get a standard driver's license. Right now, 44% of all licenses and ID cards are not real ID compliant, and we must move to make that 46%, and then 48%, and then 52%, right? We must thwart them in their takeover of the country through this national ID card and system. So tell your neighbors, tell your friends, look at your IDs, and then make a decision about what to do. And you can certainly come to our website, because we got an entire section on real ID.
So is this something that they're going to sync with your medical information also, as part of that, like, vaccination, whatever thing?
Right. So it could be. So here's the deal. You have to know what the law says. The law says that one single person, the Secretary of the Department of Homeland Security, can make a decision about what the real ID card has to be used for. And so it's not only nuclear facilities, federal buildings, and commercial airlines. The law says, and any other purposes as the secretary shall determine. So in the future, they could determine it's medical care, it's registering at a hospital, it's buying a car, it's getting married, it's opening a business. Whatever this one person decides is a national security issue, and that's not even, it doesn't even have to be, but that's what it would be claimed for. They could decide that, and they could just issue it. And then suddenly you would need this card, and then it all gets pulled together in one big tracking system and one big command and control system over your life. So you have to refuse the real ID.
That is scary, scary, scary. Oh my goodness. So, ladies and gents, please be sure to look into the show notes and go to the website, CCHF, or should I say CCHfreedom.org. But remember, we have the link in the show notes, and there's just a plethora of resource links, from the toolkit to the information about DNA, to the information regarding Medicare. So lots of really good information. And don't keep it to yourself, okay? Make sure that you send this recording to other people that you know that are perhaps our seniors that are getting ready to move into that zone of being taken care of by Medicare, or mommies who are having babies, because I had my baby, well, 4 of them, And I didn't realize that this is what they were doing with their data. And who knows what they can do in the future. That's the scary thing. Not just what they have done so far, but what can be done as we move into a much more technologically advanced civilization. It's going to be really bizarre. So in any case, be forearmed for the world that is on our doorstep. And I thank you once again, Twyla, for joining us and for sharing all of this phenomenal information and these resources. And thank you for everything that you're doing to fight for our rights, to fight also for the rights of our doctors. We didn't even get into that. So I may have to look at that later. But thank you for all that you do. And for the rest of you that are here with us today.
Thank you so much. I really enjoyed it.
Until next time, peace and blessings. Thank you for tuning in for this episode of Mommy Heal Thyself. If you like what we're doing here, please share, subscribe, like us, and leave a comment. Your